Well, these are the charts that seem like a good idea to track the course of infection. And this was put together by David Downs. So thank you, David, from sunny Down Under in Australia. Just a remarkably good idea to monitor these vital parameters. And we've looked at those in previous videos, and they are available to download from a link that I'll put at the bottom of this video and from my website. Now, welcome back. If you've come back, it's still Monday the 20th of April. I kind of ran out of time last video because if they're too long, they don't upload properly. So I wanted to focus a bit on Africa, which has been a big concern. And I'm just going to mention South Africa briefly. Then we're going to focus in on the small African country of Malawi as an interesting case study for the problems of Africa, which I've been worried about for some time. And I know quite a few of you have as well. So South Africa, quite a sophisticated country in many ways, but still with a lot of very poor areas and difficult areas and other social challenges. So the number of cases and deaths still not too high. Of course, the testing's not that great. We'd like much more testing. The initial cases came from Italy. So COVID-19 flew in from Italy to South Africa, which was unfortunate. But with the lockdown measures in South Africa, the growth has been relatively slow. So they have slowed things down. Quite concerning videos today on the news about homeless people in Cape Town and other places in South Africa being moved into camps where they're going to be somewhat concentrated together in accommodation by the looks of it. So can't help but feel they would be safer outside. But that's what the South African government seems to do as policy now. Now, it's good to see that health workers are going around door to door monitoring for symptoms. And of course, that's going to greatly raise awareness as well. So that was encouraging. But the healthcare system in South Africa is extremely limited and extremely challenged. And 80% of the population depends on the public healthcare system. So as cases increase in South Africa, as they unfortunately inevitably will, there's going to be significant healthcare challenges. Now, I just want to show you the country of Malawi, which I want to look at a bit more detail today. Now, I'm sure you know where it is, but that's Malawi down here. So this is Lake Malawi. So we're getting towards 3/4 of the way down Africa, the small African country of Malawi, which I want to focus on. It illustrates what's going on in quite a few poorer African situations, actually. So now in Malawi, the population is 19 million. It's a very poor country with very many challenges. Now, the suspected cases are 449. The active cases are 12. The confirmed cases are 7, and the deaths are 2. And that is straight from the Malawi government website, maintained by the Malawi government. And it also says that there's 429 tests have been performed in the country. Now, that is on the Malawi government website, and that is basically all it says. So you start looking around for other things to look at in more detail, and it's simply not there. That's pretty well the sum of it. And about 429 tests have been performed so far in the country, mostly on people that are sick. And that's about 20 tests per day. You don't need me to comment further on that, really. Basically, we don't know what's going on there because there's essentially no testing. But we do know there's cases. Now, most deaths in Malawi are not reported anyway at the best of times. So the health surveillance infrastructure in Malawi is very challenged as it is. But I've got a reputable source from inside Malawi, and I'm reliably told that there's transmission in 3 different towns already, 3 different geographical areas of Malawi, where there is already community spread. So remember, first of all, we get cases, then we get clusters, then we get community spread. So basically, we can conclude from this that community spread has already begun in Malawi. We don't know how extensive it is, but it's ongoing as we speak at this moment on Monday, the 20th of April. it's happening now, and I'm afraid rapid spread in Malawi is possible because of the living conditions. In fact, I would go further. There is almost certain to be rapid spread in Malawi and other poorer African countries. And the Malawian government anticipates an attack rate of 85%. So basically what the Malawian government are saying is they expect 85% of their population to be infected with COVID-19 before this pandemic is over. And from that attack rate, the Malawian government are currently estimating 50,000 to 100,000 deaths in the country. Now, if there's 50,000 deaths, that would be 0.3% of the population. If there's 100,000 deaths, that would be 0.6% of the population of Malawi. Probably going to die from this virus. And given what we know from other countries, I'm afraid it could well be that it's more than 0.6%. There's a lot of pre-existing HIV in Malawi, which is going to reduce the efficiency of the immune systems. There's a degree of malnutrition, which we know reduces the efficiency of the immune system. So it could end up with a higher case fatality rate in Malawi than in other places, I'm afraid. Hospitals have very little personal protective equipment. And to say that there's healthcare challenges, it's actually that's a euphemism, but that's a bit silly really. That many people in Malawi have essentially or very, very poor access to professional healthcare. So the healthcare facilities that are there are weak, and the protective equipment is also very weak. And there could well be a collapse of the healthcare provision in many parts of the country, in Malawi and in other poorer areas of the world. And really what I'm saying now could apply to areas of Pakistan, Bangladesh, poorer areas of the world that are severely challenged already and are going to be even more severely challenged by this virus. Now, staying with Malawi, the conditions in Malawi: close-spaced, single-roomed houses. The whole family typically lives in one room. At the best of times, most people do not have running water. At the best of times, most people don't have electricity or refrigeration anyway. So without running water, it's quite hard to keep your hands clean. These challenges are there anyway. This is going to make everything worse. Many families live day to day, hand to mouth, on what they can earn, grow or sell during each day when they leave their homes. So there's no reserves to fall back on. If they don't go out to work that day, members of the family won't eat. And my sources in the country say enforced lockdown would cause rapid starvation. It's that stark. So the lockdown measures that have been implemented in other countries could reduce the spread in Malawi, but people are going to go hungry. So it's a bit of a problem. The Malawian government has given general advice on hygiene, social distancing, things like that. As far as I know, they're going ahead with the presidential and election campaign in the next few months. And a lot of the income in Malawi is from selling tobacco, and the tobacco auctions and floors with people there are still opening. Now, my source in Malawi said flattening the curve, in a sense, serves little purpose. Now, what he means is that this is the sort of graphic that we've been looking at for various countries. So I need to zoom out a bit. So this is the number of cases going up here, and this is time going along here. So if we take the UK, for example, what was happening was the number of cases were starting to increase. And this dotted line here represents the ability of the healthcare system to cope with the amount of illnesses, with the amount of conditions. Now, when we were originally going for the herd immunity strategy in my country, allegedly, I think we were going for a herd immunity strategy, what would have happened then is that the number of cases would have risen, and the number of cases would have been well above the ability of the health service to cope, meaning that many people would be severely ill but not have access to healthcare because it was above the ability to cope. So by implementing the lockdown strategies, the aim in my country, when it's largely succeeded, was to get that down to under a level, and then hopefully going down where the health services could cope with that. And if the health services are coping, that means less people are going to die. The case fatality rate is going to be lower. So it makes a lot of sense to flatten the curve, to squash the sombrero, as our Prime Minister said, to get that down, because more people would have died. The case fatality rate would have increased. But in a country like Malawi, so if the cases are increasing now as they appear to be, now what's going to stop the pandemic is people developing herd immunity. And they'll develop herd immunity because they've suffered from the illness or because they've been vaccinated. That's the only thing that's going to stop this and return everything to normal eventually. That has to happen. It's a case of minimising and mitigating the amount of people that are hurt and get really sick in that time. And in the UK, it makes sense to flatten that curve so the health services can cope. But in Malawi, the health services are so weak anyway that they can't cope. They're not going to be able to cope anyway. So, in a sense, there's not a lot of point flattening the curve because there's no way that it could be flattened to a point where the health services can cope, because the ability of the health services to cope in Malawi is going to be down here somewhere. So it's going to be absolutely impossible to get that curve down to a level where the health services can cope. So that means there's not too much point flattening the curve, or this is the thinking, so it might as well just follow its own course. Herd immunity will develop, and then the infection will gradually decline. But of course, that means that for nearly all the time, the amount of infected cases are going to be above the ability of the health services in Malawi to cope. But we know that's going to be the case pretty well anyway, regardless. So, reading between the lines, there seems to be a bit of a fatalistic attitude here. Though, why bother flattening the curve because we can't cope anyway? And given that the economic costs and hunger will be generated by a large-scale lockdown in Malawi, people seem to be questioning what is the point of a lockdown in Malawi. And I can see what they mean. So, yeah. Enforced lockdown will cause starvation. General advice given. Elections, tobacco, flattening the curve. Now, funerals are a huge part of Malawian culture. And big funerals are a big thing in Malawi. And big funerals have been setting off from the hospital morgue this week, as usual. Crowds at funerals, guaranteed spread. Roadside markets remain crammed and busy. There's Easter religious gatherings. So what this means, I'm afraid, is there's going to be a high number of cases in the next few weeks in Malawi. And a few weeks after that, the number of deaths are going to increase. So where does that leave us? It's a desperate situation. You know, in hospital, I've been there when people have died many times, often in acute situations, and will carry out a resuscitation or something. And if a member of the team who's leading the resuscitation will normally say, well, I think that we should call it now. I think this is finished. And a good team member will say, well, a good team leader will say, well, does anyone want to carry on? Then if the most junior member of the resuscitation team wants to do another couple of cycles of resuscitation, then most good team leaders will do that, because when you walk away from that situation, you have to know that you did everything you could. And when relatives die, again, I've had to tell family members, husbands, wives, children, parents, on quite a few occasions that their close relatives have died. And you can look them in the eye and say, but we did everything we could. Absolutely everything possible was done to save your loved one. It just couldn't be humanly done. And what's really just struck me is in the Malawi situation, for example, is there is so much that we could do to save so many lives in Malawi if there was international cooperation there. So, when I look back at this situation, I'd like to say, well, yeah, there were deaths in Malawi, but do you know what? We did everything we could, or in Bangladesh, or wherever it is. And I'm just thinking that this time next year, the world will look back and say, well, yeah, there was deaths in Malawi, and do you know what? We didn't do everything we could. That could well be the situation. Now, just to close on a slightly more upbeat note. Sorry, that's getting all... Well, it's realistic, I'm afraid. This was sent in to me. People in Malawi are working to make personal protective equipment and operating equipment, so that's good. They're trying to mitigate the damage. And here we see this gentleman proudly wearing the products. So excellent to see these homegrown efforts there, and I wish them every success with that. Now I'm just going to close with this picture. This is a bit personal to me, really. This is from Leanne in France, who sent me this in, and it's just sort of... It just struck me that it's really a humbling thing that people basically... invite me into their homes to people invite me into their homes to I don't know, it's just a really nice thing to do, and that was a great picture anyway. So there we go. So Leanne and family, thank you for inviting me in to your home in France. Thank you.